Doing a little video today on my right shoulder, which on October 23rd I'm gonna undergo surgery. So it will undergo surgery, and I will be attached to it. So back on February 19th, 2 days before my birthday, I fell while bouldering at Pipeworks here in Sacramento, about 15 feet up, and I landed on my forearm like this. Had a anterior dislocation of the humerus, pretty common injury for what I did. I have a 50% labral tear, but it's in two kind of 25% sections, so they might leave that. I am for sure getting what's called a biceps tenodesis. What that is they're going to cut my biceps tendon and they're going to move it slightly, drill a hole in the bone, like where the track that the bicep naturally rides in, and then they're going to pin it down in there. The other thing that may or may not happen is repair of my supraspinatus. So the supraspinatus is pulling away from the bone, but that's very common for a lot of people my age. So it's whether or not there is strength in that tendon at the attachment point. So if it's pulling away too much, what the normal procedure is they cut it, they move it over, and then it gets pinned kind of back. That shortens the tendon itself, and it really shortens the muscle. So it could limit my range of motion, and it's also going to be a lot longer recovery time. So if I just have the biceps tenodesis, which by the way, the biceps tendon, the connective tissue that held it in its track is gone. So the biceps tendon is not riding currently in its track, and it's sawing into my subscapularis tendon. And that's a pain that I feel when I lift my arm laterally and extend the arm. It's getting worse. So I'm having the surgery at the ideal time, I feel. And I'm just kind of nervous, the tenodesis is about a 6-week recovery, and the supraspinatus repair is about a 9-month recovery. And from what I understand, it's 9 months to be back to normal. I've worked with people that have had this surgery, and sometimes it's taken them up to a year and a half, 2 years to get back full strength and full flexibility. So we'll see what happens. I have kind of a unique strategy going into the surgery. I'm going to fast 48 hours prior, and then I'm going to fast 48 hours after, which means I'll be taking no oral pain reduction medication. I am probably going to use a little CBD, and I'm going to use some enhanced breathing and cold therapy techniques to kind of reduce that inflammation, and then just let my body's natural healing process be that first thing that hits. The problem with a lot of NSAIDs, so ibuprofen, for example, it actually blocks the healing process. So you can't take it immediately after surgery. They usually give you Tylenol-based opioid painkillers. So my plan is, instead of using those, I'm going to use CBD, and probably anywhere from 20 to 40 milligrams every 3 to 4 hours, and try to keep my blood level stable with that to keep the pain down. And then in the weeks following my surgery, I'm going to do a 3-month cycle of MK677, growth hormone secretagogue, 30 milligrams a day, broken up into two 15 milligram segments. It's got about a 12-hour half-life. And then I'm going to use a booster called CJC 1295 with DAG. DAG or DAC, which is just something that extends the life of the compound in your system. So for example, the MK677 I'll be taking every day, twice a day for 90 days. And the DAG, the CJC 1295 with DAG, I'll just be injecting once a week. So that's going to hopefully help me with my healing process. I will also be on a 1 meal a day reduced calorie diet, where I'm going to exclude all grains, all inflammatory foods. I'm only going to have these 3 proteins: grass-fed, beef liver, but I can also do any kind of liver. Like I'll do organic chicken, I'll probably do some lamb liver, I'll probably do some buffalo liver. I love me some buffalo liver. And then sardines, and I'm gonna get wild caught sardines just packed in water. And the huge benefit to sardines, you get your omega-3, omega-6 and 9 fatty acids. You're going to get your EPA, DHA, but you also get the bones. And so the thing about sardines and the thing about healing or recovering from surgery is you need calcium and phosphorus in the relationship that they exist in nature, which means eating bones. And we used to eat bones. We don't eat bones anymore. So eat bones, people. The sardine has this really nice spine, and I just love crunching into it. And the nutrition is going to help me heal. So then the last animal protein that I'll have on my 1 meal a day diet is eggs. And I'll do eggs with every meal. And I'll try to have those 3 proteins with every meal. And then I'm going to fast. I'll do 2 days a week of just water, or water, vinegar, sea salt, or water, lemon juice, sea salt, something like that.